Cervical cancer is cancer that begins in the cervix, and the cervix is the lower narrow part of the uterus that connects the vagina to the uterus. And cervical cancer develops really slowly over time, and it normally starts with a cell having abnormal growth. So its early detection is very important because you can catch it while it's still treatable in stages like 1 where they can remove those abnormal cells. Cervical cancer is usually almost 100% caused by the HPV virus, it's the human papillomavirus. The HPV virus is very common. It's the #1 sexually transmitted disease. So anyone who's sexually active will eventually get HPV in their lifetime. Usually HPV clears on its own, but when you have like persistent infections with high-risk types, the types that cause cancer, in terms of cervical cancer, it's HPV type 16 and 18 that causes most of the cervical cancer. So if you keep getting these high-risk infections, you can develop cervical cancer over time. So this is a normal cervix. It's smooth, healthy, pink, and you don't see any cells, any abnormal growths. And then the next step, we show them this one is the benign cervical tumor. So it's really life-threatening, and these tumors grow, but they don't spread. So they just remove them, and they don't usually grow back. And then when we get to these stages here, you can see the progression of cancer. So it starts with a abnormal cell in the lining of the cervix, and this is like the earliest stages of cervical cancer. And then it moves to being more invasive and deeper, and then you have a like very invasive advanced cervical cancer here. So the importance of Pap testing is that if you catch it here, you can remove the cells, and even here you can remove the cell because it hasn't spread beyond the surface yet. So the early detection really prevents the invasive cancer from spreading. So the population is anyone with a cervix age 21 to 65. So from 21 to 29, it's a Pap smear, and that's every 3 years. And then when you turn 30, you have 3 different options. You can either continue with the Pap smear, which is every 3 years. You can do an HPV test only, which is every 5 years, or you can do a Pap and HPV co-test every 5 years. It is very, very important to have continuous continuity care where you can get all the primary care in one place, because the screenings, like I said, 3 years, 5 years, and it's easier for the health system or your primary care home to keep track of the information than you are. They're more likely to send those reminders versus like a busy mom or a busy person trying to figure out when they need to go in to get the screenings. So the recommended guidelines is routine recommendations. You can start as early as age 9. So it's 9 to 12-year-olds. That's the routine recommendation for vaccinations, and it's a 2-dose series. So similar to the Pap, where there's lots of options, this one's a little bit confusing as well. So if you are 9 to 12 years old, you can get 2 doses of the vaccine. And then if you are 13 or 14, you still get 2 doses of the vaccine, but it's not in the routine age range. And then when you're 15 and above, you have to get 3 doses of the vaccine. All the way up to 26, and then now a couple years ago, they added 26 to 45. So you can get the vaccine all the way up to age 45. And 26 to 45, it's a conversation with your provider. So you and your provider will go over the risks and benefits of getting the vaccines at your age, and then you'll make an informed decision whether vaccination is right for you. The vaccines are very, very safe. They've been studied for decades, and they're very safe, very effective, and we've seen dramatic decreases in cervical cancer among those who have been vaccinated. Huge decreases. I think a study came out recently this month talking about how there's a drop in cervical cancer incidence among women in their 20s because of the vaccination. And in some countries, they are proclaiming that they have no cervical cancer cases. Self-test kits are these kits that you can purchase, and it's easy, convenient, and it takes away some of the barriers that women face when going to get a in-person Pap exam or HPV test. So it helps with accessibility and location, so the women can do it in the privacy of their own home. They don't have to worry about going to the clinic, taking time off, and the test kits are very simple and easy to use. So what you do is you register your kit first, and then it just comes with these very simple pieces. So it's a cotton swab. So you swab the inside of your cervix to the line, and then you'll snap it off, and then you will take the tube and then put the Q-tip into the tube. Close it, and then you label the tube, and then you put it in the bag and you mail it off, and then you get your HPV results. So it'll tell you if there's a detection of HPV within your cervix samples. And it's just as effective as a in-person clinic exam.